Hospitalizations are on the rise once again here in Virginia. They have doubled since the start of the month of December. Our Henry Graff has that part of our team coverage.
A spokesperson for the Virginia Hospital and Healthcare Association says that's a big jump as healthcare workers now enter their fifth surge of this pandemic. Across Virginia, more than 1,900 people are hospitalized due to COVID-19. That number stood at 922 on December 1st. It represents a 106% increase.
So obviously the concern is that as these numbers keep going up, that we will again, reach elevated levels of both cases and hospitalizations, which puts a great strain on the healthcare delivery system and the dedicated caregivers and clinicians who work there.
HCA Virginia's Chippenham Hospital is seeing a slight increase in COVID hospitalizations. In light of the Omicron variant spreading, Virginia hospitals continue to face staffing shortages. The HHA says its hospitals are adjusting staffing models and bringing in a staffing agency to help attract more medical workers.
But staffing really is a challenge, especially when you have team members who contract illness, whether in their personal lives or in the workplace, and then have to abide by quarantine and isolation guidelines.
The HHA spokesperson says time will tell if recent CDC changes to isolation guidelines will help frontline workers, cutting quarantine time in half. The guidance is very specific for asymptomatic people who are also fully vaccinated. At its peak, the HHA said more than 1,000 staff members had to be sidelined due to COVID-19.
I don't think it's any secret that certainly folks, who work in healthcare here in the Commonwealth and elsewhere in other places, have dealt with burnout, have dealt with stress and strain.
The HHA is working on ways to deal with those issues, including a program called Care for Caregivers, providing mental health support to those on the front line. On your side in Richmond, Henry Graff, NBC 12 News.
All right, Henry.